And this is Henry Sanders back with another episode of Real Talk. We want to thank our sponsors at Park Bank. Thank you for everything that you're doing for us. Thank you for Facebook and the Journalism Project. Thank you for supporting us. And if you want more of this content, please go to our YouTube page to see more of our wonderful interviews over the past couple months. Today I have a doctor, not a physician doctor, but like a PhD doctor. I don't know if that's better or worse, but he's a smart guy. He's a smart guy. And we are going to talk a little bit about COVID-19. But Dr. Sethi, how are you, sir?
Pretty good, Mr. Sanders. How are you?
I'm good. I still, these COVID-19 days are still hard for me knowing what day is what. It's still hard for me, but but I'm doing okay. Are you at home mostly now? How are you dealing with this? Are you still kind of social distancing and self-quarantine yourself?
Yeah, so I work at the university and they advise all of us to work from home, especially if we can. As they reopen, I think people who are running the labs are going to try to get back in, doing it safely, but someone like me can work from my computer, so I do that. I go in like maybe once a week if I find out I have a package or, want to get the mail or something.
And what's your job? Tell us about what you do at the university.
Yeah, so I'm a professor. I'm an epidemiologist. I study infectious diseases. Of course, never did study coronaviruses before 2020. But I do infectious disease epidemiology, and a lot of the same methods apply. A lot of people on campus are rolling up their sleeves to try to help with the response. And I'm just one of many of those people.
Yeah, I think I read early on that the universities, a lot of universities across the country are doing a lot of the research, right, on this. Is a lot of universities doing what you're doing right now?
Yeah, I think anybody, this is a crisis. I mean, I think anybody with skills in and out of the university wants to do something. I think everybody's feeling a call to service. A place like UW-Madison, we're a land grants university. We owe it to the state to do what we can to help what's going on in our backyard.
So what do you find out with the coronavirus that's different from other viruses? What are you finding out so far?
The main thing is that this is completely new. I mean, they called it novel coronavirus because no one's ever seen it before. So no one's immune system is trained to fight this thing. And when something's brand new, it spreads very fast because no one's immune system is able to fight it at all. And I think for me, what the most astonishing thing is that it was, first reported out of China to the World Health Organization at the end of December. And in a matter of like 4 or 5 months, every country, every continent has cases and deaths. That's like really fast, how fast that spreads. And I think it just makes you really respect what we're up against.
When you first heard about it and whatever alarm things you were hearing, did you think it was going to be this bad? So when you first heard about the coronavirus, you said, okay, people overblowing this thing, or, it's just another version of the flu. Like, what was your thinking?
So the virus is SARS-CoV-2. It's got like 80% similarity to that first SARS virus. And I'd say like a part of me was a little hopeful that, we wouldn't see cases in the US because the first SARS never reached our shores. They had some in Canada, but that eventually died out. And so there's like a panic we felt because it's a new virus, and the reports out of China didn't sound great. But, the hope was that maybe it wouldn't reach here. And then once when it did, and very quickly, new cases were popping up. Like every day, you'd find out new cases were coming. And then I think Madison had the 6th case in the country. And then it really feels like it's close to home. And then you just throw out what you're expecting because you thought it was close to SARS. This is very different. It's much more infectious.
Yeah, it's just, like you said, it's amazing how fast it spread. That's just amazing. Do you think, so when people are going back to work now and the safe at home order is done, we're having protests where no one's social distancing anymore. What you know about the virus, doctor? Do you think we are in trouble? And do you think this is going to have an impact from all these protests going on and people going back to work? Do you think we'll see a second wave of the virus?
It won't be surprising if we do, because there are a lot of people who have not had the infection, and so everybody's still susceptible. In the summer months, we tend to go outside anyway, and so uh, it's not going to spread as much outdoors than indoors. And then as soon as things get cold, we go back indoors, and then holiday travel. Um, Not to say that this is going to be seasonal, but a lot of these respiratory infections eventually become seasonal, just like flu. So that's where I think the second wave is likely. Um, with the protests, yeah, this is one of those can we walk and chew gum moments, and I think we can. I think we should. Um, I think we can handle controlling COVID because everybody knows how to. It's just really a matter of individuals, taking the right precautions so that they don't catch it, or if they have it, they don't spread it.
So that's interesting. So you seem like you're a little confident. You're confident now that with the second wave, I mean, I know as confident as you can be, but as if a second wave hits, it sounds like you're saying you think that the hospitals are going to be prepared to handle it better now because what they've gone through in the first wave.
Well, I mean, I think the hospitals are definitely, paying attention to what the trends are, and they're going to stay, prepared for that. Um, no, but I mean, I'm not confident in the sense that, it really is kind of an unknown how things are going to go. But one thing I think I feel good about is that we're not in that state of naivete anymore. I mean, in January, the virus is probably circulating in the US. It was in New York and the East Coast, as they saw. So before the first cases were identified, it was already circulating. We really had no idea that we were already exposed to it. That was when we had total naivete. We're not going to return to that, right? That's when we saw those really steep increases in case numbers on a daily basis. And so my hope is that it will go up with any opportunity the virus has to infect another person, but I'm hoping it'll not be as like a crisis situation. But the goal is to have it go down, not to go up. That's really important.
A lot of universities were doing research for a vaccine or antibody testing, etc. Are you doing that type of testing and stuff at your university?
The hospital is doing antibody testing. I get my healthcare group help. I know you're on the board there, so I haven't. Yeah. There you go. Yeah, thank you. I haven't gotten an email from you guys telling me that you're offering antibody testing. It's on my goal to find out. But I know UW Hospitals is. A friend of mine made an appointment, I think, for it might even be today. So you can get an antibody test to find out if you had the infection before. Those test results are a little tricky to interpret, so they're not as clear cut as the test that actually measures the virus itself, the PCR test.
Do you think that everyone's talking about safer at home, and you hear about the herd and that, also herd immunity? So how do you think this plays out realistically? Right, September hits.
Yeah.
I guarantee parents are going to put their kids back in school, right? I mean, but it might not be safe to. Yeah. And we won't have a vaccine by then, is my guess. So? What do you think? What do you think the best process would be at that point?
Yeah, in some ways, I wish we would stop thinking about herd immunity, unless we have a vaccine, of course. Then we can start maybe thinking about it. The reason is because I don't know of any examples of diseases where an entire population, a whole country, was able to get herd immunity to something it's never experienced before, especially that fast. The studies that have looked at antibodies, even in New York, big cities, I mean, there's a lot of people who have not been exposed to the virus. The other thing is these antibody tests don't necessarily mean that the kind of antibodies you have give you that protection for the rest of your life. It just shows that you develop an immune response. It means your immune system's working, you developed an immune response, and it could be measured. But it's hard to know whether it's the kind of immunity that will last forever. The the coronavirus that caused the common cold, typically you have immunity for 1 or 2 years, and that's why you can get colds again from coronavirus. This is not quite the common cold because it gets in deep into our lungs and doesn't stay in just the upper respiratory area. And so there is some hope that with that kind of virus, with that kind of biology, that the immune system does develop immunity that lasts forever. But those studies need to be done, and we just don't know. So honestly, I don't think herd immunity is going to develop unless we have a vaccine and the immunologists tell us that the antibodies that form when you get this kind of infection do last forever. Then I'll feel more comfortable talking about that.
Do you think we'll have how soon do you think we'll have a vaccine?
Well, this is like unprecedented, rapid sort of timeline to get one going. There's like 80 some or 100 candidates that are being tested. And so they think, Tony Fauci, our voice for the country, is telling us late December to 2021, within a year, let's say, there'll be a vaccine that's out. What I'm so impressed by is that they are already creating the facilities to manufacture the vaccine. So when the results come in, if it turns out that the candidate that they are testing is working, they'll already have a stockpile of vaccine ready to go. And I think that's really great. We just need that data to show that it's going to work.
You mentioned something earlier about summertime and people wanting to get outside, which leads me to swimming. And what happens when people swim? Can they catch it in a pool? Is it effective? I know there's chlorine in the water, so the layman person would say that the chlorine will kill the virus. What happens when people go swimming and stuff like that?
Yeah, I mean, there's no proof that this transmits to the water, and it'd be kind of unusual. I don't know of any respiratory infections where that can be the case. The thing is that, the public pools aren't private pools. So you're sharing a lot of space with a lot of people, all the tables and chairs, all those surfaces that you might touch and somebody else touches. That's the one opportunity for the virus to spread. And then just those close quarters. I'm not a great swimmer, but I can tell you that it'd be kind of hard to keep 6 feet away from each other in a pool. I mean, that's not easy. Plus you're breathing heavy because you're in the pool. There's a lot of exhaling. Just not a safe environment. It's really no different than like a movie theater, but you just got a lot of water.
Yeah. Well, I'm always concerned about the summertime because I think people especially when you're in Wisconsin, you're in this cold, and when it gets warmer, you just want to get outside. So swimming is one thing. So tell us things that you think people can do safely. Riding a bike by themselves, they can do safely, right?
Oh, yeah. I mean, all forms of exercise are good. You can do anything you want outdoors. I think the main thing is if you're going to be within 6 foot of someone who's not in your own household, then it's a good idea to at least have a mask with you. And you should also maybe even wear it when you're in a really crowded environment. It's a good idea. Part of it is so you're protected in case somebody else has the virus. Or if you have the virus, you don't want to give it to somebody else. And I think that's really important. Keeping hand sanitizer nearby is always helpful. The physical distance, hand washing when you get a chance. And I think when you're in an environment like the protest, for example, if it's good to monitor your symptoms afterwards because that can be a high risk environment, and monitor those symptoms. If anything just feels off, there's a free test for you available, and they test every day but Sunday in Madison.
All right, last question here. Are you shocked how the coronavirus has impacted people of color, especially the Black community? I mean, the death rate is, I think it's about 30% or something like that in Wisconsin. So, are you surprised about that, how it's impacted Black folks, and is it really because of underlying issues?
I am saddened, sadly, and I'm saddened that I'm not shocked. Because, we've got a lot of health disparities, not just in Wisconsin. Wisconsin doesn't do great in a lot of things when it comes to health disparities, but it's a national problem. And this pandemic is highlighting something that needed to be addressed yesterday. This is just amplifying something that we already know. And so it's sad. It's just really unfortunate. Um, I don't really know what to say. I would like to see that go away. But right now, with the rise in cases, the impact in Black and Brown communities, I'm hoping this will be a good call for doing something about health disparities. I think that's really key. And now that we're talking about racism, I think even better, let's really tackle this issue from a health perspective and a justice perspective.
Yeah, it's ironic that you're saying that because I think one of the good and bad things about that can come from Mr. George Floyd's murder is the good thing is people have to pay attention to this stuff, right? And they have to take a deeper dive and racism. You can't deny it. You see this man getting killed, like you just can't deny that. I think the bad thing is we just put the narrative where it's just about protest or it's just about the police, and there's a lot more to come when it comes to racism and disparities. And like you said, health is part of it. So I just hope that out of this that we don't get just focus on this part of the racism and kind of look at the whole systematic way how racism plays out. And COVID-19 is a perfect example of how our system's in place that Black people and our brothers and sisters, Latino brothers and sisters are impacted too.
Yeah, you said it well. Like I said, this is our walk and chew gum moment. We can handle both. Maybe we should handle some more than just two things. We should really put our thinking caps on and try to figure out how to solve these problems.
Yeah. Well, thank you for your time, sir. We want you to stay safe. You're welcome. Come back on Real Talk anytime, and enjoy your weekend.
Hey, likewise. I hope you stay safe too, and thank you for the invitation.
Yeah, thank you. And we'll see you at our next episode of Real Talk. Thanks for joining us.